program it's a part of the low vision continuum of care clinics, and it's designed to sort of treat and catch those veterans who are not legally blind but are having difficulty with their day-to-day lives, tasks such as reading the newspaper, seeing loved ones' faces, in some cases driving a car. We're trying to help those veterans get back to doing the things that they enjoy doing and maintaining their independence and quality of life. What happens is we are a referral-based clinic, so the veteran tends to have, not all the time, but the majority of the time, an eye examination from their optometrist or ophthalmologist within the VA, have a set diagnosis, and have sort of a stable eye condition. Not all eye conditions are stable, but we don't want them actively changing. They come to us. I'm going to do a low vision evaluation, which means we're going to check them for their glasses to make sure that they've got the best corrective lenses that they can have, and evaluate several low vision devices based on their goals. So if they want to see things like far away, we'll look at telescopes. If they want to read price tags or spot the nutrition labels on soup cans, read their medicine bottles, we'll look at handheld magnifiers, and then there's a brief ocular health evaluation at the end. It's about a 2-hour process from start to finish. If a veteran states that he's having functional problems to their eye doctor, then that kind of qualifies to come into the exam. So if they're saying, I can't read the newspaper, or I'm having trouble reading price tags, then we say, come on in. We're not so worried about a low-end visual acuity cutoff. So we're not so concerned that they're 20/40, 20/50. We want to know, are you having troubles with your day-to-day life? There is sort of a guideline or a cutoff at the end stage. So if they're legally blind, the best program for them is actually the Blind Rehabilitation Center, because it is a continuum of care. So we don't want to drop off the guys that are in the middle, but when they're at the end stages of legal blindness, then coming to a blind rehab center where you can get more comprehensive and intensive training is the place that they need to be. If they decide that they don't want to come to the 6-week program, then we take them back at the low vision clinic. It's just that the training is not quite as intensive as what you would have at a blind rehab center. We're gonna, again, check for glasses, check for different types of optical devices. There's a lot of training done by our low vision therapists, so training on how to use those devices. We look for lighting to see if there's certain types of lighting that you can benefit from. Ergonomics, like a lot of the low vision devices, you have to hold things closer so your neck can get sore. So we look at ways to make it so your posture you don't hurt your neck when you're reading. There's a lot of education by the low vision therapist on learning how to use your vision in a different way, because when you have a vision loss, we can't restore your sight, can't give it back, but we can maximize the vision that you've got left. So it's learning to work with what you have left as opposed to replacing something that's lost. So there's a lot of education and teaching on how to use your remaining vision. There was always a blind rehab center, but historically, if you weren't legally blind, then you didn't qualify to go to a blind rehab center. So you may be having troubles with your vision, but there wasn't really a place to go. So we have a lot of vets that were waiting to be seen for years. There just wasn't the service there, and so they're very excited, very happy, and we've gotten really positive feedback. They're very thankful, and loved ones and family members are thankful, because usually when you get to that point and you have an eye disease, you've been told there's nothing else we can do for you, so that we can't make your eyesight better, and we can't either. A low vision isn't designed to make somebody's eyesight better, but what we can do is maximize what you have left. So we're always saying there are things that we can do for you, and so when they see that they can do it, then it's usually a big thank you, and hugs. We get a lot of hugs and thank yous.